Hey, Safety Pro podcast community. I'm really excited about this interview. I wanted to do a podcast episode on, just innovative ways that we can sanitize our work environments, various workspaces, especially coming out of 2020. And we're, well into spring for 2021 now. And the pandemic is still, pretty much with us. So I was doing some research. I came across this company. Actually, our paths crossed. The timing could not have been more perfect. And Grant Morgan, the CEO and co-founder of R0.com, R0.com, so it's the letter R, 0.com. The products that they're making and that they've come up with and introduced into our, industries, into our markets, is really incredible. I was really curious about what they're doing. I went to the website and I thought, I've got to talk to this guy. And no affiliation. This is not a paid sponsorship. This is not a product review or anything like that. And it's literally how this should be done, which is I was curious about this topic. I wanted to share it with you, the audience. Grant Morgan had this idea and had some investors and partners in business and basically launched this thing, and we got together and we geek out over it. So that's pretty much it. I mean, the interview is going to speak for itself. You're going to get a lot of great information out of this interview. Before we get into the interview, though, I have to tell you about our partners in safety here at the Safety Pro podcast, and that is Mighty Line Floor Tape. Yep, you've heard me talk about them before. They are great partners in safety, been supporting the podcast for many years. Great folks over there. Look, if you have floor marking needs, you have a warehouse, you have a store, an industrial shop, grocery store, supermarket, corner market, doesn't matter. If you have to mark your floors for any reason, if you have to have directional signs, if you have to have social distancing signs and stand here signs, please wait here, or whatever you have that involves marking your floors. They have a great video, by the way, on their website about why you should not paint your floors and a good comparison. But look, head over to mightylinetape.com/podcast. Just for being a podcast listener, you get a free sample of their incredible floor tape to try out for yourself. And they've been doing this for some time now, so please take advantage of that. It lets them know who sent you. So again, support those that support us. mightylinetape.com/podcast. And now we can go ahead and jump right into the interview with Mr. Grant Morgan. Grant, you are the CEO and co-founder of R0. And I know we're going to get into all the fun stuff you do, but just tell us a little bit about your background. What is R0 and what are you into these days?
Absolutely. So my name is Grant Morgan. I'm one of the three co-founders and the current CEO of R0 Systems. And, I'm a mechanical engineer by training and by nature, I guess. And, started my career in medical devices and pharmaceutical manufacturing for big companies like Abbott and then a few smaller companies as well. Where I got to stand up and lead a neurovascular value stream where we got to, make permanent surgical implantables for neurovascular applications. And so kind of cut my teeth and started my career in medical devices. And shortly after made the leap to the digital world. And I was on the founding team of a company called iCracked, where we're basically like the Uber for smart device repair. And so, had a network of about 15,000 technicians all over the United States, Canada, and Europe. And when you broke something, you'd press a button. We'd send someone out to you to fix it wherever you're at and be on our way. So I led the product and engineering teams there, grew the company. We were acquired by Allstate a couple of years ago. Spent a couple months getting the ship to port, left, started another company, and fast forward to about March, April of last year when the pandemic really hit, and got in touch with my two co-founders who I'd known from previous ventures, and we felt really compelled to jump in and figure out what we can do to help, and out of that was born R0. And R0 is fundamentally, we are a biosafety company. So we exist to help our customers create safer spaces for their employees, patrons, guests, and reduce the spread of infectious disease in commercial spaces. And so, effectively, what we're doing is we're taking hospital grade technologies and we're democratizing the access to them by adapting them for these commercial spaces where they're historically not necessarily used all the time. But the end goal with what we're doing is to create these safer spaces, not only help people be safer in the spaces where we spend so much of our time, but actually feel safer as well. So that's kind of
Nice.
what we are and who we do.
You've been busy. So
Yeah.
I did some time in med device as well, spine implant manufacturers, and doing safety there. So it's interesting. I mean, the culture is a lot different there. When we talk about manufacturing in general, I mean, we have this image of, manufacturing, and, it varies from product to product. And that has the whole med device manufacturing industry. There's this culture, everything you're making is going to go in somebody's body. I mean, I did aviation manufacturing as well. Same thing. They were hardworking welders and fabricators, and they were just skilled craftsfolk, and they understood this is going to be flying somebody's family across the world, and so manufacturing is, and skilled trades in general, it's serious business. And
it is. There are literally lives at stake. And
absolutely.
I think that's one of the things that allowed us to move so quickly as well, is that, there's nothing more motivating than knowing that, there's an opportunity cost to every single day.
Yeah. Yeah. And so to your point, focusing, taking something that is historically, okay. So you said, cleaner, safer spaces. What are we talking about here? We're talking about UV technology, right?
Yeah. So our first product is UV technology. It's very similar to it is the same, in fact, as what's been sort of the gold standard in hospitals for a number of years. But the platform that we're building and the observation we had when we started this company was, look, we haven't done a particularly great job at preventing the spread of infectious disease in commercial spaces, and the evidence of that is that 40 million Americans get the flu every year, and somehow we've just accepted that that's normal. MRSA or staph kills more people annually than Parkinson's, AIDS, and murder combined. Most people don't know.
Really, MRSA.
Yeah, MRSA.
Really?
Yeah.
Man.
And then that's not to mention E. coli, norovirus, all these other pathogens that are endemic to our customers' spaces. And so, coronavirus was the catalyst for this business, but we realized that there's a huge opportunity to do disinfection and infection prevention in these commercial spaces much better, more efficiently, more effectively than we've ever done it before. And we can do it without chemicals. And that's where the UVC light comes in.
Yeah, and that's where I was headed with that. So it was great that you got to talk about that and introduce this topic to the listeners. That, going back to that, this culture around manufacturing and how important, how critical manufacturing is to not just, GDP and just, the economy, but to people's lives. When you think about med device manufacturing getting shut down because of something like this, people who have surgeries that will improve their lives, save their lives, are impacted. The supply chain, aviation, we know what happened with the aviation travel industry. Just I know folks that were just out of work because the aviation industry was shut down. So being able to make it safer during these types of times, if that's anything we've learned out of this, is, okay, how can we become more resilient to these types of disruptions so that we don't have to shut down wholesale entire industries. So taking something that has been used historically in one area, and you say democratizing it, talk a little bit about what, and it's not like you all woke up one day and said, hey, we could sell a UV light to these guys over here and they can use it in their lobby or in their manufacturing plant. There's a lot to it, right?
Yeah.
So, I mean, don't have to, peel back the curtain all the way, but like, what do you mean by democratizing it so that we could bring it to other industries?
It's a great question. And I laugh because the way that you kind of described it, where, we didn't just wake up one day, that's actually kind of how it did happen, but it's not how it typically happens. So what ended up happening was, and it's funny you touch on the aviation industry, and and some of the historical events there. We actually studied a number of historical events, and 9/11 was actually one of them that we looked at. And out of 9/11 came basically the entire Homeland Security apparatus for the United States. So we hired 14,000 TSA agents. You still have to take off your shoes, and you can't take liquids through airport security. We founded the Department of Homeland Security, and all of these giant societal and infrastructural changes came out of that terrible, tragic event. And the thesis was that coronavirus at the time that we were thinking about starting this business was orders of magnitude more impactful and on a truly global scale, not just from a loss of lives perspective, but also from an economic devastation standpoint. And so we wanted to do something to really alleviate both of those things. So, physically create safer spaces, and then also hopefully accelerate the economic recovery long term. So what we ended up doing was we got in contact with a gentleman who is now our chief scientist, Dr. Richard Wade, who was the head of Cal OSHA for over a decade. He's taught at Harvard, Oxford. He's an infection prevention specialist and an occupational health specialist. And so Dr. Wade kind of led us on this journey of studying what hospitals do to prevent infections. And if you think about what a hospital is, fundamentally, it's kind of a communal gathering place for the sick. And as long as hospitals have existed, they have the highest risk environments and the biggest challenge to keep the patients safe from each other and keep the frontline workers, doctors, surgeons, administrators, all safe from the patients. And so we started studying what do hospitals do, and particularly the best in breed hospitals. And fundamentally they do three things. They deal with the hands. So they scrub in, scrub out before and after surgery. They practice good hand hygiene. The second thing they do is they do manual disinfection with specially trained environmental services staff and special chemicals as well. But as we know, all humans are imperfect, and studies actually showed that about 50% of surfaces in a hospital room upon terminal room cleaning, 50% of those surfaces are actually missed. And so what the third thing was that we discovered for the first time along this journey was that the best hospitals in the world that do the best job at preventing infections use UVC light. And UVC light is not new technology. It's been around for over 100 years. In fact, the 1903 Nobel Prize for Medicine was awarded to Niels Finsen for the use of UVC to treat lupus. And it's been used in wastewater treatment applications since the 1910s. It's been used in air and surface disinfection since the 30s and 40s. And more recently, for decades, it's been used in hospitals. And so the body of evidence proving the germicidal efficacy of UVC is huge. The problem is that it hadn't proliferated outside the hospital into commercial spaces. And so, we asked ourselves why, and we started digging in and realized that the products sold into hospitals are typically anywhere from $60,000 to $125,000 a piece. And,
Wow.
Being an engineer myself, I looked at these things and like, these are light bulbs on wheels with a timer. There's no way they can be that expensive. And so, what we discovered was it's really just an artifact. The pricing is an artifact of the healthcare system and the current state of it. And so essentially what happened is back in 2010, when the Affordable Care Act went into place, a few things changed. So they had to increase taxes to pay for the expanded coverage and reduce costs to pay for the expanded coverage. And prior to 2010, Medicare and Medicaid were reimbursing hospitals for hospital-acquired infections. They're HAIs is what they're called. And that's a $35 to $40 billion a year economic burden on the hospital system. And what happened with the Affordable Care Act is the Medicare and Medicaid came back to the hospitals and said, hey, look, this happened on your watch. And you're going to bear the responsibility and the consequences for these HAIs happening in your space. And that's when the market for these sort of portable UVC whole room disinfection devices really took off within hospitals. And they were able to garner such a high price because these companies will walk in and they'll say, hey, look, if you prevent 2 or 3 HAIs, then this device pays for itself.
Oh, wow.
inevitably it works, and the hospital's happy because they're reducing their overall costs by investing in this equipment. But what we wanted to do, and this is where the democratization part comes in, but what we wanted to do was build something that has the same or higher efficacy as anything that's sold into a hospital, but we wanted to price it based on what it costs to manufacture, not how much value we can extract from the institutions and organizations that we're selling to. And so we did that. So we designed, developed, and manufactured from scratch our own whole room hospital grade UVC disinfection device in under 5 months. And
Wow.
what we did, a couple of unique things that we did, but one of the unique things was the business model. And so instead of offering the device for purchase for $125,000 or whatever, we came out to market with a hardware as a service model. And so we recognize that a lot of the organizations that we serve are economically distressed, and we wanted to be sensitive to that. And so we broke it out into essentially monthly payments, and you can think of it as a lease. And it comes out to about $17 a day, which is affordable to just about any type of organization. And so, that's tying this thing full circle, taking this technology that is traditionally used in hospitals and that we know works, and adapting it for commercial spaces, but offering it at a price point that is, amenable to the types of customers who haven't had access to this before. That's what we mean by sort of democratizing access to hospital grade disinfection.
Nice. Yeah. And I mean, you're right. And you're speaking our language, like my listeners, safety professionals, workplace safety professionals. When you mentioned Cal OSHA, I mean, I know exactly who you're talking about. We deal with this all the time, right? The ROI of, how do you sell prevention methods, measures to the C-suite, for injuries and accidents that haven't happened yet.
Yep.
Right. So, this is what we do. We're in the prevention business. So
Yep.
I totally picked up what you were laying down on how easy it was for somebody to walk in because they experience it in real time. It's a hospital. They know, right. It's almost like, it's like when an attorney, selling insurance for malpractice, right? It's like that sells itself. So
exactly.
So yeah, great. So give me an idea of how this might work. I know some folks that I've been talking to leading up to this episode are there are some safety concerns. Does it work? And all that good stuff. Well, we know it works, but like how could you practically deploy something like this in various commercial spaces, like common spaces you would think of?
Absolutely. And if you caught me last week, I would have a device behind me. But unfortunately I just moved. So for the listeners and the viewers, apologies for the, stark white,
new office, right?
Yeah. The new office, but I don't know if you can see any of the boxes, but, to kind of paint the picture, of, how this works. Imagine basically a 6.5 foot tall, cylindrical, device that has 8 UVC bulbs, high output UVC bulbs. Think of them like fluorescent light bulbs, essentially. And it's on wheels. And you wheel it into a room. You plug it into the wall. You set a timer and you hit go. And then you have about 30 seconds to leave the room. And once you leave the room, then it runs for whatever the cycle time is. It's between 3 and 7 minutes, depending on the size of the room. And when that cycle's over, you come back in and everything is disinfected. And so speaking to the safety piece, that was something that was super important to us. One of the reasons why we believe that UVC has not made it into the sort of mainstream is because of the lack of regulation. And, I came from a highly regulated industry in medical devices, and that was one of the reasons I ultimately left. But in this case, I think some minimal regulation is really good for the consumer. And so what I mean by that is there are no uniform performance standards for consumers to be able to compare devices, apples to apples. B, there are no safety regulations or standards that say, hey, look, this is potentially harmful wavelength of light. You need to take appropriate precautions to make sure that there aren't any exposures. So we see these companies that are selling products to schools even that don't have any safety mechanisms built in. And that's a problem. And then, the other thing is that there are no regulations requiring companies to back their efficacy claims with actual data and testing. We think that, in the same way that like a Lysol spray or a Clorox spray or bleach, any sort of household cleaner that says 99% disinfection or whatever, that has to be backed by data, by law. UVC is not the same way right now, but we believe it should be. And that's why we sent our device to a third-party lab to be tested to ASTM standards against 4 different challenge species: human coronavirus, MRSA, which is staph, feline calicivirus, which is the norovirus family, and then also E. coli. Yeah. Nice. And so against all 4 of those challenge species, we proved over a 99.99% reduction in those pathogens. But getting back to the device itself, the safety mechanisms that we have built into it are redundant. So first of all, we have PIR sensors at the top of the device. And so 6.5 feet tall, they have a great field of view. They're long range and highly sensitive. And so essentially, if anybody walks into the room while a cycle's in progress, the device will automatically shut itself off. Nice. Similarly, when I mentioned there's a 30-second countdown at the beginning of each cycle, if someone's still in the room when that countdown finishes, the device won't turn on. But one of the things I didn't mention that is unique to our device, and sort of our point of view on what this industry should look like, is we actually baked in LTE and Bluetooth into the device. And so it generates and emits data in real time as it's used. So we can tell you when it was used, how long it was run for, where it was used. And that data is collected automatically, so the user doesn't have to do anything. It's sent to our cloud offering, where we can then report on it in a dashboard. And what your audience might appreciate is we originally designed it for compliance. And so, oftentimes, especially larger organizations that maintain multiple sites, they don't have full visibility into what's happening. So you don't know if your janitorial staff even came at night, unless your trash bags knew in the morning. But right. You also don't know how good of a job they did. They might sign their name on a piece of paper and a clipboard, but you don't have that sort of execution compliance. And so with our device, we actually have this sort of auditable trail of disinfection activities that are happening within a space. And we can prove with data that something happened at a certain time. So compliance is big. Risk mitigation, you can imagine the implications on risk mitigation for a company being able to say, look, we did everything that we could, and we can prove it with data to keep people safe. But what we're finding, and it's really interesting, is that a lot of our customers are actually taking that data and sharing it externally with their stakeholders, so their employees, their patrons, their guests, or whatever. But they're doing that to reestablish trust that they are doing something differentiated to keep them safe, and hopefully, accelerate the economic recovery for these businesses. So that's been a really interesting use case that we're really starting to enable and double down on.
That's interesting. That's pretty cool. So Bluetooth and LTE built in. It's got the sensor. So you start the 30-second time countdown. If you aren't out of the area in time, you got to start it all over again. You got to start the whole process all over again. It's not going to engage, right? Because it senses somebody in the area.
Yeah. And nice. If it's actually interrupted mid-cycle, it'll actually pause the cycle. And so when you come back in, you have to play again, hit go, and it'll resume where it left off. But if somebody walks in, you actually get to see that in your dashboard. So you can see an event that lets you know that there was a possible exposure, an intrusion alert is what we call it. And so, nice. That's another added benefit to collecting that data.
I tell people, going back to MRSA, I tell people all the time, I worked when I was doing consulting. I had a manufacturing client, and they had an on-site medical clinic, and the physician there, he was telling me, like, 90% of the infections from small lacerations that were just first aids, they're going to turn into an OSHA recordable injury because they're going to get infected. And I can tell you right now, there's MRSA all over this place. I'm like, clean the place. What? And he was like, it's an old manufacturing site. It's huge. How are we going to clean everything? And this was years ago. And I feel like calling him now and telling
tell him you know a guy.
I know how you can clean it. Yeah, I know a guy. So that's great. So some of the questions, I wrote down some questions from colleagues when I was asking about just in general UV light for sanitation for cleaning. What about and you mentioned like the data logging and for compliance for quality assurance. What about like the life of the bulbs? Is there a way to monitor that? And talk a little bit about the bulb itself. I'm using bulb because I don't know if that's what you're using, but
no, that's exactly
okay.
what it is. And fundamentally, it is a fluorescent light bulb, similar to what goes in your ceiling. A little bit
Mhm.
different, but you can think of it the same way for all intents and purposes. But the life of the bulbs that we use they're very long life, so they're about 16,000 hours. Is what they're
Wow.
rated for. Now, in practice, what happens is when you cycle the bulbs, what you're doing is you're actually hitting the filaments in the bulbs with a really, really high voltage and running a lot of power through them, and so it degrades them. And their useful life is actually less than 16,000 hours. And so we have done a ton of testing to draw sort of this degradation curve. So we know, when we're at about 90% of the maximum output of the life of the bulbs. And the beauty of our hardware as a service model is we'll automatically ship you new bulbs when you need them, and
Wow.
then we'll recycle your old bulbs for
Mhm.
you as well. And so
Okay.
we make it super easy on the user. They don't have to track anything. They can see like kind of like an odometer, how much life is on those bulbs in their dashboard, but they don't have to think about or do anything other than just popping the bulbs out of the sockets and replacing them with new ones, and dropping the old ones into a box to recycle. But it's super
Nice.
easy.
Nice. That was a question that I had, and I'm like, I don't know. I'll ask Grant and about that one. So you made it really easy to monitor that and to get those changed out.
Mhm.
So you mentioned schools, you mentioned education. What about like what are some other common spaces that are starting to use these now? Like, so let's start with public places.
Yeah. So public places. In public places, so we're working with some transit authorities. So think about like bus stops, and a lot of them, any indoor space there, the bathrooms, they have like snack bars, whatever,
Yep.
concessions, places like that. So transit authorities, we're working a lot with professional sports teams in stadiums. So think like press boxes, concessions, bathrooms,
Oh yeah.
the locker rooms, the training rooms, things like that. Um, that's a huge use case for us. The corporate office space is starting to pick up now that things are starting to reopen a little bit, and what we're finding is that employees are starting to hold their employers accountable. They're having this realization about how vulnerable we really are and how much work is a petri dish. Like
Mhm.
humans, we're indoor species. We spend
Yeah.
90% of our lives indoors, and a third of that is spent at work. And so, the implications of that are your facilities manager, or the person who makes the decisions about the health and the safety of your building. That person has a greater impact on your overall health and well-being than your doctor does. And so,
Wow.
the responsibilities and roles of these people are shifting, and expanding very, very quickly, as I'm sure some of your listeners can appreciate. And it's a tall task, but there's a lot out there to consider. But the responsibility and even the obligation is huge. But we're working with a ton of different corporate office reopenings right now to do conference rooms, bathrooms, open office spaces, cafeterias, things like that. And
Yeah.
then, yeah, a little bit of everything. We're in jails and prisons too. But blessing and the curse of this business is it's perfectly horizontal. Everyone needs health and
Yeah.
safety.
It's what I call it universal truth. It's, to be safe and secure, whether at home or at work or in life, that's a basic human desire, right? I
Hmm.
mean, you can go with Maslow's
Yep,
hierarchy of needs if you
it's the
want,
foundation.
after breathing and eating, staying, sustenance, it's safety and security. And
Exactly.
so you're tapping into this is our world, right? This is what we
Exactly.
do. We help people stay safe. So another question was, in a room with you mentioned like a gym, like the sports setting in a gym, a workout room, lots of hard surfaces. If the light can touch it, it can sanitize it. Or is there a
Absolutely.
range, or is there like
Yeah.
what's
The intensity. So basically, what we want to measure and what we are optimizing for is called a dose. And all the doses is just the intensity times the time of exposure. And so it's the UVC light works with the same principles as light from the sun. So, sunburns are a good example. If you get a really high dose, so you're in a hot place that's close to the equator, for example, closer to the sun, and you're exposed for a long time, you're going to get a worse sunburn than if you're further from the sun and not exposed for very long. So same principle applies to the light that we use to disinfect. And so the bigger the room, the longer the cycle time that's required to achieve the same level of disinfection. And so one of the things we do with our customers, with every customer, is we actually handhold them through the onboarding process, teach everyone on their team how to use it safely and effectively. We teach them where to put it and how long to run it for. And it's dirt simple. There are only 4 buttons on the device. There's on and off, start and stop, and then there's up and down. And so it's dirt simple to run, no matter who you are. But we help you understand, where to put it and how long to run it for.
Nice. So where can folks go to learn more about this technology? And this is just this is the one product that you have, right? Okay.
Yep.
And do you have something similar or in a different space?
Yeah. So what we're building, and I mentioned a little bit earlier, but our observation about this space is that there's a huge opportunity to create safer spaces, and pathogens have evolved, but the tools and technologies we use to fight them have not. We're still using bleach. There, you can go look up, bleach commercials from the 1800s that are selling. These chemical manufacturers are making the same exact product, and it's archaic. And we think that we kind of took a step back and said, what should this space look like in 2020 and beyond? And to us, that's a lot more IoT connected hardware, a lot more data and data science to derive some actionable insights, a lot more software to automate workflows to feed those insights back to our customers and influence behaviors in advantageous ways. And what that manifests itself into is this platform where we have hardware devices that are deployed into our customer spaces that attack and mitigate risk across all of the different vectors of transmission for these different viruses and pathogens, really. It's air, surface, and person to person. And so, we've got a touchless hand sanitizer dispenser with an integrated thermal sensor on the side coming out soon, where the premise of the device is essentially stop pathogens at the door. So, you take a temperature screening from your wrist from our device instead of, today's state of the art is someone walks up to you with something shaped like a gun and points it at your forehead. Not a great customer experience.
It's a great look too. Yeah.
Yeah, exactly. But we take the temperature reading from your wrist, and if you have an elevated temperature and you're shedding a virus ostensibly, you can be prohibited from coming into the space and getting other people sick. Now, if you're not sick, but you touched an ATM or a gas pump or picked something up on your hands, you can get it off of your hands and kill whatever's on there with the hand sanitizer. That device generates data about its usage and emits it to our cloud. We have an air product coming out that is an upper room UVGI device. And so essentially it works by creating a beam of ultraviolet light across the top of a room in an area where humans don't go. And it works with natural convective currents. So when you breathe out the air that is ostensibly contaminated, if you're sick, is hot, and it gets carried up into this beam of light, gets disinfected, and then by the time it cools, it's safe and dropped back down to where humans are. And this product is a phenomenal augmentation to existing HVAC units. So instead of a school, for example, spending $7 million to retrofit their central HVAC system for a couple $1,000, you can install one of these things on your wall and add 6 to 12 air changes per hour, or the equivalent of 6 to 12 air changes per hour. So
that's like a light filter. Like instead of it going through a HEPA filter, trying to pull air through a physical media, right?
So
that will capture pathogens. This is going to kill it in the air.
Yep, you nailed it. And the way we talk about it is kill, not capture. So so you absolutely nailed it. But all of these devices are going to be IoT enabled and connected. They feed data back to our platform. And what we're going to be able to do with all of these devices deployed into our customer spaces is paint this holistic picture of the health and safety and the risk associated with those spaces. And so we'll have devices that can help understand the flow of traffic, where people congregate, and therefore where the risk is. And then we can automate the workflows and turn on the devices nearby to mitigate that risk in real time without any human intervention.
Nice.
So that's what sort of the picture that we're painting of the future that we see in sort of taking this holistic approach to biosafety within these spaces.
Yeah, I definitely see this growing because, I'm seeing all kinds of crazy stuff like supermarkets are doing, or even just, warehouses and other manufacturing sites having to deal with just how do we get to the point where people can just start coming back to work, right? Now, they haven't even thought about like, how do we manage when they're here? How can we just open up? And they usually do this. They cycle them, right? We'll have people come in, we'll watch them and make sure they're staying away from each other and wearing masks and whatnot. And then we got to kick them all out when they leave. And then we physically have to go and make it clean again. And then go in, it sounds like some of the things you were talking about can actually touch every step of that process of as they're coming in, when they're in, and then of course, when taking advantage of downtime at night, with the UV light and stuff. So that's great. It's a great way to think about this holistically from an end-to-end type of process, not just one moment in time in a business's life, which is at night, or the janitorial staff comes in and everybody's gone, right?
Exactly.
Which is very important. You still have that, but I love the vision of looking at this holistically. It's good stuff.
And I think to your point, it's you need it all, right? Like it takes a layered approach, and we're not displacing jobs here where the janitorial staff doesn't come in at night. That's still necessary, but I mentioned earlier there's this expanded scope of responsibility. Now you have facilities managers that are expected to be epidemiologists, and so the way we see ourselves fitting in is we are tools and technologies to make them more efficient, take some stuff off their plate so they can focus on getting up to speed and succeeding at this expanded scope of responsibilities. And then also look good to their superiors and make them the hero. So, we can do this more efficiently and effectively than it's ever been done before. We can cut labor costs. We can displace chemicals and reduce your chemical consumption costs and the like. But, ultimately, we hope that results in sort of an acceleration back to getting people in these spaces, and we're actually seeing that with some of the businesses that we're working with, either a bump in business after implementing and articulating that they are using R0 products, or the like.
Yeah, you're speaking our language. Are you sure you're not a safety professional?
Trying.
So we all are technically, but a layered approach. We use the Swiss cheese model. We talk about we've been talking about that for years, and of course, the pandemic has introduced. I know you hear all kinds of politicians or whatever talking about Swiss cheese now, and now it's become commonplace. I mean, safety. My colleagues and I we kind of chuckle because it's been a struggle for our entire professional careers that, of trying to sell workers on the benefits of PPE. And now we have people running around that couldn't spell PPE before, or as experts on masks work, masks don't work. And it's like, oh my goodness. So, obviously the big benefit here is you touched on it earlier, is trust, is confidence, is like, look, are you doing something? And I've seen, and firsthand, and I know I've talked to other colleagues that have been tracking these things, a spike in like contact dermatitis, skin reactions, because companies, they don't have a choice. They're like, they bring in this army of, I envision that movie Monsters Inc., where they put the tent over you and shave the monster when you've come in contact with a human. But they come in and they have to shut the place down. They come in their suits and they fog the place.
Yep.
And it leaves a sticky residue everywhere, and some surfaces can't be fogged, so they have to wipe them. And then you introduce that, you probably missed some areas, but we've had an increase in just allergic reactions to chemicals. And so this is, you're speaking our language when you talk about like substitution as an engineering control, or as a on the hierarchy of controls to reduce hazards. Substitution, we still got to clean it, but how you clean it is what you're addressing. And
exactly.
That's great. That's
Yeah,
good
and
stuff.
I think you nailed it. And one of the things that we think is going to happen in the world is I think that you'll see a decrease in the use of chemicals. And you touched on it a little bit, but one of the objective facts about chemicals is chemical exposure, and especially occupational exposure, is strongly correlated to massive increases in different respiratory diseases like asthma or
Yeah.
COPD, which happens to be one of the top killers in the United States. And so the hard part is it takes a long time to develop these sort of chronic symptoms and chronic issues. And so I think the chemical companies have been able to sort of dodge the responsibility
Yeah.
for some period of time because it's hard to make that direct link. But the science is clear, and intuitively, like when you walk into a room that was just cleaned with bleach, if that bleach is killing stuff on the surfaces, like of course it's going to be harmful to your lungs, and you can smell
Yeah.
it and feel it. And we've talked to customers who are housekeepers or janitorial custodial staff, whatnot. And I won't throw anybody under the bus, but one of the groups that we shadowed at a hotel was one of the women was saying that she actually dilutes her own bleach because at the end of a day, her lungs and her throat burn from the exposure to the concentration of bleach that she's required, by her job to
Right.
apply every day. And so breaks my
Wow.
heart, and it compels us even more to proliferate this solution, just because there's a better way. These tools exist.
Yes. That's why I wanted to talk. I'm such a geek, number one, and I love learning about new things, but we're safety professionals, and we're all about learning and growing, improving, innovating. And one of my mantras has always been, the old school safety person. And I shared this on social media recently, an interview that Matt Damon did on Conan O'Brien, where he was joking about meeting Tom Cruise, and he wanted to ask Tom Cruise how he did that stunt in the one movie where he jumped off the building. And Tom Cruise tells the story of, okay, first thing you do is you go to the safety guy and you tell him what you want to do. And he's like, and the safety guy said no. And then Matt Damon goes, okay, then what'd you do? And Tom Cruise says, I got another safety guy. And I share that all the time because one, you get to name drop a couple of big actors, but two, is safety isn't about saying no. It's about innovating into work. It's innovating our way into what needs to happen. We need to keep these places clean, right?
Yeah.
We're going to open up. How
Yeah.
we open up is going to make the difference. And you're right. We can't just hose the place down. Oh, we can. Some people are still doing it. But that, that introduces so many other issues that I think, and to your point, in 2020 and beyond, 2021 now, we don't need to. And I'm glad that there are companies out there like yours that are taking a hard look at this, a serious look at this, and seeing how we can introduce this technology to more and more workplaces that probably wouldn't have thought about this stuff before.
Yeah.
Right.
Yeah. Well, I think it's interesting. Like my PR team is going to kill me for saying this, where we just did a survey. We haven't published the data yet. That's why they're going to kill me. But I'll tell you guys. But
Okay.
we just did a survey with Harris Poll, a very legitimate, reputable polling.
Oh, yeah, absolutely.
A group, but did an employee sentiment sort of poll to understand like how are they thinking about returning to work. And the data was clear. 92% of respondents said that they think that their employer is responsible for creating and maintaining a healthy workspace, and is responsible for their overall health and their risk of infection there. 67% of people surveyed said if they didn't feel like their employer was doing making significant and lasting changes to their sort of infection control and operational protocols, 67% of people said they'd start looking for a new job. And so I think for the first time in certainly my life, the power is with the employees, and this obligation of employers to maintain a healthy workspace has always existed. But now I think you're going to see accountability come into place, and accountability in the form of choosing where to work. And so I think there's going to be a mass exodus of talent from companies that don't change, what they were doing, don't adapt. And then conversely, I think it's going to become a huge competitive advantage to invest in healthy spaces for some of these companies, and the ones that do it well. The ROI is immeasurable. Not only are you going to have a better talent acquisition and retain a retention of top talent, but you're going to have more productive and engaged employees too. There's a ton of science out there that shows that the health of the workspace directly impacts cognitive function and capacity. And so we think that now is the time to start ushering in some of those things that we know work, and start proving that, look, this is a worthwhile investment. It's always been a worthwhile investment, but now we have the unfortunate circumstance of being able to focus on this and say, like, look what can happen if we're not prepared.
Yeah. What do they say? Necessity is the mother of invention, right?
Yes, it is.
There it is. So, hey, great stuff. Where can our listeners and anybody watching this video go to learn more about your company?
Absolutely. R0.com. So R, and then you spell out the word zero, RZERO.com.
Perfect. I will have links to r0.com as well. And that way it'll be easy for them to just click in the show notes when they're listening and check out the website. Anybody that is looking to do what Grant was just talking about, up their game when it comes to providing a clean, sanitized work area and protect the safety and health of the most valuable asset any business has, which is our people. Go to r0.com to learn more. And if you have any comments, questions, that you want to share with us about this technology, UV technology, go ahead and click on the link and jump in on the conversation over at the Safety Pro podcast community page. That's where we are going to post the video of this interview for those of you who are only getting the audio. And click that link once again to join in on the conversation over at the community. Grant, I can't thank you enough for taking time out of your busy schedule. I know you got some unpacking to do and everything, and here you are talking to some safety guy about your stuff. But it's that passion and that dedication that we love, and I appreciate it.
Yeah, thank you so much for having me, Blaine. And one thing for your viewers, I just wanted to express my deep and sincere gratitude for what you guys do. You guys are the true heroes. Have been unsung for a long time, but now it's your time to shine. And so I have a tremendous amount of appreciation and gratitude for the work that all of you safety professionals do. So thanks for listening to us, Blaine. Thank you for having me. I really appreciate the opportunity to come speak to your audience.
Anytime. We'll have to do it again soon as you get into some new products and technology to help us make our workplaces safer. So I appreciate it. Thanks.
Awesome. Thanks a lot.
All right, there you have it. My interview with Mr. Grant Morgan. Remember, go to R0 and check out their products and services. They have some really cool stuff coming out. And I like the innovation. And I'm big on this, right? And he touched on it in the interview of, we've been doing cleaning, quote unquote, the same way for so many years. And there are better ways to do it. And I love that folks are innovating. And what's going to fall out of this, is all of these folks that are on this sort of this leading edge of innovating in a particular space. What's going to come out of all the work they're doing are some maybe some standards around this type of technology and its use in the workplace, maybe some certifications, and he talked about a lack of regulations, and we really need to fall back on the general duty clause that, okay, this wavelength of light can cause harm and can cause damage, so it's going to kind of be rolled up into the general duty clause. And there are some other areas of the standard that would apply as well, but this is really good. I think that we need to be pushing and our boundaries and innovating in a measured, controlled, safe way. But this is great stuff. I'm total geek for new things and technology and better use of technology to keep our people safe. So let me know what you think. Drop your comments below. What do you think about these types of approaches and some of the other things he was mentioning about, active ways of sanitizing the environment instead of relying on the old HVAC system pulling all this air in and trying to capture the air versus in real time sort of that high level light The thing was pretty cool, by the way. So, look, just drop your comments. Let me know what you think. And I hope you enjoyed this interview.